Welcome to Essentials of Pharmacology for Health Professions, 9th edition. This is Chapter 4, Medication Preparations and Supplies. Please read your book or ebook, as this is just going to be a summary of the chapter. Upon completion of this chapter, you should be able to differentiate between various oral and rectal drug forms, describe the various injectable drug forms, define the following types of injections: intravenous or IV, intramuscular, IM, and intradermal, ID. Explain how the different type of injections differ in administration and absorption. Compare the IV injections referred to as IV push, IV infusion, and IV piggyback. Contrast the various topical drug forms. Explain the advantages of administering drugs via a transdermal patch. Describe inhalable drug forms, and identify various supplies used in the preparation of medications. Drug forms and devices. As you learn in Chapter 3, drugs can be administered through the gastrointestinal or GI tract or the parenteral route. GI tract is referring to routes that include the oral, nasogastric, or gastrostomy tubes, and rectal. Parenteral administration routes is referring to those that do not involve the GI tract, and those are your injections, topical, transdermal, and inhalation routes. The ways in which drugs are prepared is just as extensive as the routes in which they are given. Drug form is referring to the type of preparation in which the drug is supplied. The route of delivery will provide guidance on how the medication is most suitable for what it is intended and the most appropriate means of absorption. Drug form and drug preparation, these terms are used synonymously, meaning that they are very much alike. If you have a physician's desk reference, or PDR, if you look in that book, this lists the forms that are available for each drug, and they will be listed under the heading How Supplied. In your ebook or book, there is a table 4-1 with common abbreviations for drug administration. One example of a drug form is CAP, C-A-P, or capsule, and an example of a route would be IM, or intramuscular. And there are other examples there in that table. If you recall from Chapter 3, the drug administration routes include oral administration, injection, IV, rectal administration, topical application, inhalation, and implantable device or devices. I will discuss those in further detail on the next few slides. The oral drug forms include tablets, which are discs of compressed drug. There are a different variety of shapes and colors, and they can be coated to enhance easy swallowing or even scored to allow the tablet to be cut. The enteric coated, these have special coatings that resist being disintegrated by the gastric juices. The coating then further dissolves down the GI tract into the enteric or gastric region. For most effectiveness, the coating must never be destroyed by chewing or crushing when administered. Capsules, these are drugs that's contained with a gelatin-type container. They're easier to swallow, and if they need to be, the double chambers can be pulled apart to add the drug powder to soft foods such as applesauce or mashed potatoes or things like that, or even in beverages for patients who have trouble swallowing, and it also helps for them to be easier to administer. Sustained release capsule or tablets, these are those that contain drug particles with various coatings. These are your capsules or tablets. This form of drug is designed to deliver a dose over an extended period of time. This image out of the book or ebook, figure 4.1, illustrates oral drug forms. As you can see in pictures A through D, these are your tablet form medications. Pictures E through G are your capsule medications. Picture 8 is a lozenge medication, and pictures I through L demonstrate elixir medications. A few more oral drug forms include the lozenges. This is a tablet with a palatable, which makes them taste better, flavorings to provide soothing effects on your throat or the mouth. Patients should not swallow those and should allow them to slowly dissolve in their mouth. They're also advised not to drink liquids for about 15 minutes after administration to prevent washing off the contents in the throat or mouth. Suspensions, these are liquid forms of medications that have to be shaken before they are administered because the drug particles will settle at the bottom of the bottle. Usually flavoring of these suspensions is common because most of them have a bitter taste and because of being suspended in liquid rather than dissolved. Emulsions, these are liquid drug that contains oils and fats and water. These are typically topical or transdermal for using. Elixirs, these are a fluid extract drug with alcohol base. You should definitely want to tighten the cap to prevent alcohol evaporation, and they should not be used with small children or individuals with an alcoholic diagnosis. Two other oral drug forms are syrups and solutions. Syrups are those that are sweetened liquids that are usually prescribed for children. Solutions are liquids formed that are totally and evenly dissolved. Usually the appearance is clear rather than cloudy or settled. Many orally administered drugs are available over the counter or OTC. Usually the oral route is the easiest. It's found to be the most cost effective. It is not the route of choice for treatment in emergencies, acute pain, patients with physician orders of nothing by mouth, NPO, or patients who are not able to swallow. Another form of drugs is rectal. The use of rectal drug administration is often the choice if a patient is ordered to be NPO, or nothing by mouth, or if they cannot swallow. Your most common class given rectally are laxatives, sedatives, antiemetics that prevent vomiting, and antipyretics, which are used for reducing fever. A local analgesic effect may also be achieved by this route. The following are utilized for this type of treatment. You have your suppositories and your enemas. Suppositories are those drugs that are suspended in a substance that will melt at body temperature. An example is if it's suspended in cocoa butter. The effective route for individuals who are NPO and who do not have the ability to swallow properly. Enemas are those that may be in a suspension, which, as we learned earlier, suspensions need to be shaken before they are administered, or solution form and administered as an enema. There are several injectable drug forms, and these include liquids, which are drugs suspended or dissolved in a sterile vehicle or agent. Often the solutions have sterile water base and are referred to as aqueous or water-like solutions. Some of them have oil base for prolonged absorption time. Powders, these are dry particles of your drugs. It must be mixed with sterile solutions, diluting solutions to be administered. This is known reconstitution of a drug. Intravenous, these are injected directly into the vein. This results in immediate absorption and availability to major organs. IV drugs are usually administered by your physicians, paramedics, or registered nurses. And these examples are IV push, IV infusion, and IV piggyback. Intramuscular is another injectable drug form. This one goes straight into the muscle where the needle is positioned at a 90-degree angle. Absorption is fairly rapid because of the muscle vascularity, and usually a 1-inch needle is used for an intramuscular injection. A further explanation of intravenous drug administration is usually conducted by directly injecting medication into a vein. This allows for immediate absorption and availability to major organs. IVs are usually administered by your physicians, your paramedics, and registered nurses. There are different types of IV injections, and they include IV push, which is a small volume of drug injected in a peripheral saline lock attached to a vein. It's also known as a bolus. There's IV infusion or IV drip. This is a large volume of fluids that's often with drugs added that infuse continually into a vein. And the IV piggyback or IVBP, PB. When a drug is diluted in moderate volume, 50 to 100 milliliters of fluid for intermittent fusion at specified intervals. Usually that's every 6 to 8 hours. The images below illustrate intravenous administration. As you can see in figure A, this is a small volume of the drug or bolus, IV push, that is injected into a peripheral saline lock with a PRN adapter that's attached to the vein. IV push medication can also be injected into a port on a primary or continuous injection line, as you see in figure 4-2B. IV fusion or IV drip, this is your large volume of fluids. Usually there are drugs that are added and they infuse continually into the vein, and you see this in figure 4-2C. Figure 4-2D is showing the IV piggyback. This is the drug that's diluted in a moderate volume. It's intermittent infusion at specified intervals. The other injectable drug forms are subcutaneous, intradermal, and epidural. Subcutaneous, this is injected into the fatty layer of the tissue below the skin. The needle would be positioned at a 45-degree angle, and usually a 5/8 inch needle is used, and it's suggested for drugs that should not be absorbed as fast through the IV or IM routes. Intradermal, this route is usually used for allergy skin testing. The needle was positioned just under the skin and the bevel would be up using a 15-degree angle. Because of the lack of vascularity in the dermis, the absorption is low. Epidural, this is not typically used in outpatient settings. Those who do administer it have to be very knowledgeable about these injections, and typically they are done by the physician. This route injects medications into a catheter that's been placed in the epidural space of the spinal cord by an anesthesiologist. And there are less commonly used injectable forms. These are your intraosseous, intraventricular, intraspinal, and intracapsular injections. These are parenteral routes, and usually they're limited to a doctor's administration. The images in this picture show the intramuscular, subcutaneous, and intradermal injections. The different angles: intramuscular is 90 degrees, subcutaneous is 45 degrees, and intradermal is 10 to 15 degrees. Another drug form is topical. These are drugs that can be applied externally or on the skin. You have creams or ointments. These are both are semi-solid preparations. Creams and ointments are not the same, and the dose usually differs between them. Creams are more aqueous, they're more water-based than your ointments. Ointments are usually thicker, more viscous, which will affect how they're used with different skin conditions. Lotions, these are liquid preparations. You apply them externally to treat skin disorders. When they're applied, the lotion should be patted versus rubbed on the affected area. Liniments are prepared for external use. They're rubbed on the skin as a counter irritant. These will create a tingling or burning sensation to mask the pain in skin or muscles. And then you have your transdermal patches. These are skin patches that have drug molecules that will be absorbed through the skin at different rates to promote that consistent blood level of the drug between application times. They are varied in size, they're easy to apply, and they have long periods of effectiveness. Refer to your book or ebook for examples of each of these types of drugs. There are other preparations considered topical, or those that are applied to mucosal membranes, and they include eyes, ear, and nose drops, eye ointment, vaginal creams, rectal and vaginal suppositories, douche solutions, sublingual tablets, and buccal tablets. Some of these are administered for local effect and some are for systemic effects. The first image here illustrates a NitroDur transdermal system. This is a system to deliver medication used for prevention and long-term management of angina pectoris, which is chest pains. Next image shows topical drugs. Item A, you're looking at rectal suppositories, and B illustrates a vaginal suppository. Another drug form is implantable devices. These are available in many shapes and sizes. They're placed just below the skin near the blood vessels where the medication can readily be absorbed into the bloodstream. Diabetics use these. Examples is the infusion pump, and it delivers a continuous supply of insulin. They're also used to deliver contraceptives and to administer chemotherapy treatments for cancer patients. Another recent innovative drug that entails sandwiching the drug between very thin plastic membranes and then placing it under the patient's eyelid. This administration permits a controlled release of medication over an extended period of time. Pilocarpine, which is used to treat glaucoma, is one of those, and it has been successfully administered in this manner with little or no discomfort. The other form is inhalation drug forms. This route is very fast acting. It's second to the IV route and effective for delivering humidification and medication directly into the respiratory system. Usually it's placed in a device that will create a fine mist or aerosol that contains tiny droplets of medication. It's rapidly absorbed in the respiratory system due to the large surface area and vast supply of pulmonary capillaries. Inhaled drugs are dispensed through use of spray bottles, nebulizers, or metered dose inhalers. This picture is an implantable device or insulin pump where patients can wear these to deliver insulin continuously. There are a variety of drug forms that you may administer, so it's very important to become familiar with the supplies that you will need for drug administration. These supplies may include medicine cups, and usually these are disposable. They're used to dispense tablets, capsules, or oral liquid medication. Pill crushers and pill cutters. These will provide availability to break down medications or split pills for a reduced dose. Ampules, these are small glass containers that hold a single dose of sterile solution for injection. The ampule is broken at the neck to obtain the solution and then added to a vial holding a powdered drug. And vials, these are containers that hold powdered drugs to be reconstituted. The images in these pictures show examples of injectable drug forms and preparations. Medications given parenterally usually include A, an ampule, B, pre-measured sterile cartridge, and C, vial of powder for reconstitution. In the bottom picture, you should see injector pens, and these are usually used for insulin administration. These images show needles and syringes that are used for injections. The most common syringes are your standard hypodermic, tuberculin or TB, and insulin syringes. You see the top picture shows the parts of a syringe. You have your needle, the luer lock syringe hub, the barrel, rubber plunger tip, and the plunger of your syringe. Types of syringes at the bottom are A, you have a 3 milliliter. The B is the standard U100 insulin syringe, and C is the 1 milliliter tuberculin with the luer lock syringe. Over to your right, you have examples of various gauges and lengths of needles. In picture A, you have a 25 gauge 1-inch needle with safety cap. B shows your 21 3 gauge 1-inch needle with safety cap, and C shows an 18 gauge 1.5-inch needle. You will determine what size needle you need and type of syringe according to the type of medication and the route that you will give your medications to your patients. Safety devices. The Occupational Safety and Health Administration, or OSHA, mandates that every effort be made to reduce the risk of needle stick injuries that could lead to bloodborne pathogen exposure. So OSHA recommends safety needles with a protected sheath that covers the needle automatically after administration, and needleless devices that can be used to access IV tubing for the administration of IV push medications. Safety devices will vary depending on the manufacturer. It's very important to become familiar with the safety equipment that's used in your facility. Now let's check your answers to see what you have learned from Chapter 4. You'll have 9 questions to answer. Pause the video, write your answers down, and then check yourself with the answers provided. Look for keywords in your questions to help you answer these. Keep going, you have just a few more to answer. You got this. One more question after these. This is your last question. Answers will be provided on the next 5 slides for all 9 questions. Well, did you answer all 9 correctly without having to look back in your book or review the video? If you did, great job. If not, it's okay. You can go back and review, because this information you will see again, and it will be very helpful for you in the future. This slide can be used to further assess yourself and what you have learned in this chapter, and also enhance your learning. This concludes the PowerPoint presentation for Chapter 4. Thank you.